We started that with just a few handful of doctors and specialists, and then that grew to more specialists, and that grew to a network across the entire country, in all 50 states now, and in every specialty. So we built this enormous network of physicians who are all available to their patients for a direct pay price, and this is in specialty care.
All right, welcome back inside our proactive newsroom. And joining me now is Dr. Paula Muto, is the CEO of Apptly Health Technologies. And Dr. Muto, good to see you. How are you?
Oh, nice to be here. Thanks for having me today.
Yeah, excited to have you along and learn a bit more about the company. I know you've had some recent news out. We'll talk about that in just a second. But for those not familiar, tell me a bit about Apptly.
Sure. So Apply Health Technologies, it's actually our new name. We were UberDoc originally. So I'm a surgeon in practice, as you can see, outside of Boston. And we created a platform where patients can find doctors nearby available, make an appointment through a cash pay model. So the idea was to get patients closer to definitive care, closer to specialty care. So we started that with just a few handful of doctors and specialists, and then that grew to more specialists, and that grew to a network across the entire country, in all 50 states now, and in every specialty. So we built this enormous network of physicians who are all available to their patients for a direct pay price, and this is in specialty care. So that's basically what we created, and we have patients on the other side. So essentially, we created a marketplace, and that started off as UberDoc, and now we went public in the Canadian market in March, and now we're Apply Health Technologies.
Yeah, so you're on the CSE under the ticker APPT. So why the listing in Canada? Why did you think it was important to go public?
So it's, I'm a woman physician founder. I'll start there, and I could probably end there. Women, it's been an exciting journey, and most of the people who've supported me have actually been a lot of physicians that see where healthcare needs to go and how we need to fix the system. And that's really what drives us: price transparency, access to care. But, there's challenges when you're raising money in the United States, especially as a woman. And my Canadian investors have been amazing in Vancouver, right there. And they've been so incredibly supportive, especially to women founders. So I crossed over the border through an introduction, and I've been with them ever since. And it was really exciting to be able to take this company public this year. I think I'm one of a handful of women in North America to ever have done from an original company all the way to public. So I have to thank them for that opportunity.
And it gives you obviously an opportunity to gain more capital into the company, and that's what really is able to drive the growth, right? You've done so much as a non-public company, so I can't even imagine having some cash in there to drive growth can do for you.
Well, if you think about it, Apply is really a big story, right? And it's a big US story. We're creating a marketplace for physicians and for patients to meet outside the insurance model. That's enormous in and of itself. So getting eyeballs on Apply from the point of view of investors through the public marketplace is huge. I also, because we're about price transparency, I really like the transparent nature of the public listing. Again, in the United States, it's a lot of private markets and so forth. But our intention is always really in the Canadian markets to raise awareness, to raise investment, to raise capital, and then to migrate south of the border so that we can be trading in the US as well. But it's really to bring eyeballs to UberDoc and now Apply Healthcare Technologies, and to really begin to change the way US healthcare is delivered.
Right. You announced recently a deal with Emphera Health. Tell me a bit about that.
So Emphera is a really interesting company that comes out of a very famous surgical center in Oklahoma, where they call the Oklahoma Surgery Center. They sort of set the bar for direct pay healthcare in a surgical center. In other words, outpatient surgery. And let's be honest, that's where most surgery is now. I do things in my office. We do things outside hospitals. We call ambulatory surgery. You go in, you go home the same day. You're not spending nights in the hospital. So this surgery center was always super efficient, had the highest quality care, the best outcomes for the lowest price, because they did a direct pay model. So then they took that and extrapolated it. Where else can we go with these bundled prices? The thing is, they're the surgical center, they're the next step, but we're the first step. So they said, wait a minute, this is a perfect marriage. We need a place for patients to start the journey. how can you be in these, how can a patient find where these networks are going to be? And these are all employer-based plans now, employer-based plans who are self-insured. So they want to know the price. So we're able to give them the entire journey now so that an employee can find care nearby available. The employer knows the cost. And if they need something further with surgery, they can continue. So this is really an amazing partnership between UberDoc and Emphera, or Apptly Health.
Yeah. I want to talk to you a bit about the trailblazing part of this, because I think that as citizens, whether you're in Canada or the United States, we want to take control of our healthcare, and we want to be able to pick who we want, and for reasons that are basically personal to you. That's kind of what you're doing here, as well, as to allow people to take that extra step of sort of ensuring their own healthcare by finding the people that they want to work with.
Well, it's kind of old-fashioned if you think about
Yeah,
it.
it
You know,
really is.
bringing it back to the core principle of, a patient finding the doctor to solve their problem. It's a doctor-patient relationship. Being a surgeon from a whole family of surgeons, my father, my brother, my husband, two uncles. It's really not like, it's not what I do, it's who I am. And I think fundamentally people who are passionate about medicine understand that relationship. And we just want to bring that back because patients deserve it. And plus it's more efficient. And technology has moved us now into the offices, into these outpatient settings. So it's sort of a natural fit. And I think that you're 100% right. It gets a little confusing sometimes. Sometimes there's too much bureaucracy. There's too many people involved. You can say, like, the world of AI is eliminating a lot of steps. I think we don't need all these steps anymore. We just need to get a patient in front of a physician that is specialized and learned to be able to solve their problem. And that's really what we're doing. We're actually a very simple model.
Yeah. If you want to find a doctor, just go to the Muto family reunion, apparently. That's the way it goes with all that. Let me ask you lastly just about what's ahead. Tell me sort of the things that you're really working on here as you continue to grow as a company.
So the exciting thing is the expansion of our network. I mean, with Emphera, we are going to gain another few thousand doctors. We have another few thousand doctors in our pipeline from previous associations with some occupational health doctors. So we are able to really now expand our footprint among the doctors. And then on the patient side, we are, obviously we're direct to consumer, but now with these contracts with employers, the employers are going to be able to introduce to their employees this nice network and model, so that it's sort of bringing it mainstream. The other thing that's very interesting is that we've created a marketplace, patients on one side, doctors on the other. There are so many brilliant people out there who bring me their products in longevity, products in like therapeutics, diagnostics, and therapeutics, and that are not necessarily covered by insurance and may never be, or aren't covered yet, but are very valuable to patients. So this is sort of a wonderful place to be, where we've also created this wonderful open marketplace between patients and doctors. So I think Apptly is sort of it's sort of the first stake in the sand for the direct pay marketplace, but it's also truly a marketplace with patients and doctors. And that's kind of what I think medicine is grounded on.
Well, congratulations on what you've done so far. It really is fascinating and a very interesting company to follow. And we look forward to checking out your story as it continues to develop. So thank you so much. Really nice to meet you. I appreciate the time.
Nice to be here. Thank you for having me.
All right, there's Dr. Paula Muto, the CEO of Apptly Health Technologies.
The featured company is a paid client of Proactive Group Holdings, and this recording is disseminated by Proactive on its behalf. It is for informational purposes only and does not constitute investment advice, an offer, or a solicitation to buy or sell any securities. Viewers should conduct their own research and consult a qualified financial advisor before making investment decisions. The views expressed are those of the speaker and do not necessarily reflect those of Proactive Group Holdings, trading as Proactive Investors or its affiliates. No responsibility is accepted for any loss arising from reliance on the information presented.